Hello and welcome to Coronavirus Catch Up. I'm Jordan Kenny. We're live on the BBC News NI website and Facebook page and on the BBC iPlayer for the next 20 minutes or so. Thanks for tuning in, however you're joining us. So this week has been a bit of a mixed bag in terms of COVID-related news. There's been more positive progress with the vaccinations, but there's also been warnings that we could be living with restrictions in some form or another right into 2022. The Health Minister, Robin Swan, said yesterday during a press briefing, if we want a better spring and summer, we need to make the utmost effort now. Earlier today, Arlene Foster said the executive needs to see infection rates as low as possible before they meet next week to decide the next step for Northern Ireland.
So it's now time to push on, to use the advantage that we have, to push infection rates down as far as we can. And of course, next week is a key decision point for us. When we review the regulations on February the 18th, we need to see the numbers as low as possible so that we can safely plan for gradually emerging from the lockdown. We all want to see an end of these restrictions, but we must approach that with care so we don't lose the gains that we have made.
First Minister Arlene Foster there. Tonight I've got Professor Ultan Power of Queen's University with me, and we're going to be chatting about things in just a second. But before we do, let's take a quick look at today's figures. 9 more COVID-19 related deaths were recorded and a further 253 people have tested positive for the virus. That's according to the latest figures from the Department of Health. There are 518 people being treated in hospital for the virus, 58 are in intensive care and 57 are on ventilators. And the reproduction number, or R number as you might know it, is sitting at between 0.75 and 0.85. And briefly on vaccines, 381,894 jabs have been given out, and of those, 353,757 people have had just their first jab, and 28,137 people have had both their first and second jabs. So like I said, we've got Queen's University virologist Professor Ultan Power with us tonight. Hi Ultan, thanks for coming on.
Hi Jordan, how are you? Thank you for having me.
Good, thanks. Well, we've had plenty of questions sent in tonight for you to answer. We've heard a lot about different variations of the virus recently, and some might say that's why politicians are being very cautious about how we exit this lockdown. First of all, how have these new variations and strains come about, and how worried should we be about them?
So the reality is that there are thousands of different variants already known and already sequenced throughout the world. So this is not something new. But what happens is that some of them become, they change the properties and become what we call variants of concern. And what we know about, for example, the Kent strain, which causes an increased level of transmission. It's between 30 and 70% more transmissible than the previous European strain that was here, for quite a long time over the summer and prior to the summer. And that means then that more people can get infected quicker, easier, and it can transmit easier from person to person. It also, for that particular variant, there's a suggestion that it causes an increased level of mortality. So the more people get infected, is also a slight increase in severe disease and mortality associated with it. And that's a double-edged problem for us in the sense that there's more people going to become infected, and because more people become infected because of the increased transmissibility, it's likely that more people will also die because of this individual strain, or variant as we call it. And similarly with the South African strain variant, again, the concern there is it's a change in the surface of the virus. That means it's not quite recognized as carefully and as completely as it would be for the vaccine strain or the vaccine that's used. So it means that it escapes ever so slightly the antibodies that are induced to the vaccine don't quite kill the virus or neutralize the virus as efficiently. So these are changes in properties of the virus that have a significant impact on either their ability to transmit, their ability to cause severe disease, or their ability to circumvent or negate the vaccines that we currently have at the moment.
Okay, well, Mark has got in touch and asked us, if you have COVID and recover from it, what immunity do you have against other variants and strains of the virus?
So the evidence so far suggests that for the virus that you were infected with, you have reasonably good immunity for months now at this stage. We're up to 8-9 months at this stage in terms of good, solid immunity for the most part. There is evidence of reinfection with strains, but it's quite rare worldwide. So it looks like there's good immunity and good protective immunity in individuals for at least this period of eight months. We're still tracking it. For variants that change, again, the same principle will occur as for the vaccine, in that if the variant changes its surface protein ever so slightly, it may be less susceptible to the immune response that was induced by the first infection, and therefore possibly reinfect easier than the other ones. But again, the evidence for that is quite rare for reinfection. So I would suspect that there will be a reasonable amount of immunity induced, and therefore you'll probably avoid severe disease from a second infection with this variant so far. The analogy then can be compared with what happens with influenza virus, and here the frequency of mutations is higher than it is for the SARS-CoV-2 virus. And this is the reason, for example, why we need to change the vaccines pretty much every year to try and make sure that people are as protected as possible with against influenza with the new vaccines that are produced every year. So it is an ongoing concern. Variants will change and result in a reduced, in some cases, a reduced capacity for the immune system that has been stimulated by the first infection to be less effective against the second one.
Well, this next question, Ultan, it's from Anne. I think it's quite interesting because we've all been in this situation where we're walking down the street and maybe we pass somebody who's smoking or vaping or something like that, and we walk through a big cloud of smoke. But Anne's question is, we've been told the virus is airborne. Does this mean it can be picked up by breathing in smoke or vapor that someone who is smoking or vaping has exhaled?
So a simple answer is, if the person is not infected, they can smoke till the cows come home. It'll make no difference to anybody that's anywhere proximal to them, right? So if they have to be infected, and if they're infected, whether they're smoking or not smoking, you have the remote risk when you're outdoor to have the virus being transmitted from one person to another, breathing it in. Essentially, if you see the vaping, basically that's the breath of the person, and therefore you can see where the vaping is going. And if you're passing through it, you're going to take in a small portion of it. However, bear in mind that when you're outdoor, the dilution factor is enormous. So it's like smoking it beside somebody, for example, at a football game or a spectator, versus being in a closed pub with very poor ventilation. The accumulation of smoke is much, much more intense. Similarly, the accumulation of breath and virus will be much more intense in an indoor environment compared to an outdoor environment.
So we know the cases are falling day by day, but in comparison to figures that we saw maybe last summer, the numbers are still quite high. Another 256 positive cases today. But why, Ultan, are we still seeing so many positive cases each day? Is this a knock-on effect, maybe still from the relaxed rules over Christmas?
Transmission from over Christmas is unlikely to explain. So the big surge we had was the increase in number. The massive amount of people became infected over the Christmas period because of the relaxation. But what is happening is that because so many people became infected, there's still quite a number of people that are passing on, and they have continued to pass on the virus from person to person over that period. So if you look at the charts, there is a massive reduction. I mean, a seriously good reduction in the amount of cases relative to the peak that we had. But the peak that we had was enormous. So we're still at a level that's unacceptably high and dangerously high. For example, if we removed any restrictions at this stage, the likelihood is, now that we're in the middle of winter, we would see a surge just like we did before and after Christmas. I suspect part of the reason why we're having this ongoing transmission is because there's still actually, to my mind, quite a lot of people are not at home, leaving for work and going into work and still mixing in a whole bunch of different environments. I don't know specifically what those environments are at this stage, and it would be interesting to get some data from the PHA to see where those infections are actually taking place. But to my mind, there's still a lot of people that are still interacting, and as long as there's a good number of people interacting, the virus will follow. The virus will be transmitted from person to person.
Well, you mentioned the restrictions there, Ultan. I want to come back to that just in a minute. I want to chat about vaccines here, but just before we do, I should say, if you're watching on Facebook, feel free to get involved in the comments section. If you have any questions or anything about what's being discussed, leave it in there and we'll try and get to it before we come off air. But obviously, vaccines are the glimmer of hope that we've got to get us out of this situation that we're in. We've still got plenty of questions about them. A few people have got in touch this week asking about how safe, Ultan, the vaccine is for those with autoimmune diseases. Stephen says he's had a bad experience with a flu jab before. What can you tell us about the safety of vaccines for people with autoimmune diseases like lupus, for instance?
So again, specifically for lupus, I don't have any data, but in general, if people have any type of allergic type of reactions, serious allergic reactions, especially if they're getting the Pfizer vaccine, they need to talk to their GP or physician to have a discussion about the potential side effects of the vaccine compared to the benefits of the vaccine. So that's a discussion that needs to be had with your GP. So this is allergic type reactions. If you have other types of autoimmune diseases that are not associated with allergic type reactions, then the vaccine is unlikely to be any less safe than it is with other individuals. And the same with immunodeficient individuals, people who don't have a fully functioning immune system. It depends on the type of immunodeficiency that's there. If it's a very severe immunodeficiency where the B and T cells aren't working very well, or B or T cells aren't working very well, then the vaccine is unlikely to have a great impact. But if it's other types of immunodeficiency, then and the B and T cells are working okay, the vaccine is unlikely to cause any negative effects. It just might not be as effective as it would be in a normal, healthy person.
Well, as more and more vaccines are given out, gradually the numbers of people that we know who have had the jab or have been offered it will increase. Before I ask this question, I think it's important to stress that the current lockdown rules ban mixing of households. So you're not meant to be heading around to your friend's house or anything like that, unless of course you're in a support bubble. But how safe, Ultan, is it to visit someone who has been vaccinated if you haven't been vaccinated yourself?
So this is part of the information we don't have yet, Jordan, in terms of the capacity of the vaccines to prevent transmission. Okay, so a lot of the data from the clinical trials and now subsequently since the rollout of the vaccines has been based on stopping severe disease or hospitalizations or death associated with the vaccines. There is some promising data from the Israeli rollout suggesting that the level of infections is also diminishing in the vaccinated population. So that's good news. But as of yet, we don't have confirmation that somebody who is vaccinated is totally protected from getting infected. And I stress infected as opposed to severe disease. So if they become infected, they may become infectious, and therefore we have to be careful. And this is the reason why we say still maintain the current public health conditions of wearing a mask, social distancing, hand sanitizing, respiratory hygiene and things like that are important to maintain for the moment until we get more clear information about how effectively the vaccines prevent infection and transmission of the virus.
So at the minute, Ultan, would you be saying even if someone has been vaccinated, we should really just be treating them as if they're somebody who hasn't been vaccinated in terms of the restrictions that we follow and the mask wearing and so on?
For the moment, yes, that would be the wise course of action, because we want to make, until we have that definitive information that transmission is categorically diminished or eliminated, we need to proceed as though people are still potentially infectious.
Well, we talked there a bit earlier, Ultan, about, immunity after you've recovered from COVID, but do we know anything about how long the vaccines provide immunity for?
No, not yet. Again, the first vaccines were only administered in December, so it's still very early days. The first rollout, I should say. Obviously, the clinical trials have been going on longer than that. So we don't have clear information yet about how long immunity lasts following the vaccination, and those studies are ongoing. The choice that was made in the UK, for example, to spread the timing between the first dose and the second dose That was a calculated risk that was taken. We're still learning about the consequences of that and how well it will act as a single dose followed by a delayed second dose. So the duration of immunity, I think this is studies that are ongoing, and hopefully we will know about that in the next few months.
Just before we move away from vaccines, Ultan, I wanted to just ask, is there any difference in safety between the Pfizer vaccines and the AstraZeneca vaccines?
Not that I'm aware of, Jordan. The efficacy data and the safety data, I think, are very similar for both, in that both of them will induce mild to moderate side effects. But nothing more sinister than that. As you know, there have been some serious adverse events associated with some individuals who received the Pfizer vaccine, but sounds like it's an allergic reaction, and this is why we talked about earlier about the autoimmunity folks. There are some people who have had very severe reactions, like anaphylactoid-like reactions to the Pfizer vaccine, but the suspicion is that that's related to some of the components of the vaccine rather than the virus part of the virus that's in the vaccine. So in general, the vast majority of people, I think, very similar safety profiles for both vaccines.
We have a question in there, Ultan, on Facebook. It's from Sharon, and she's asking, given what we're talking about, she's asking, will vulnerable people ever lead a normal life again? What's the prospects for people who are, in those vulnerable categories?
So I would say yes, they will, and this is par for the course when we've got a major pandemic like this. You think back, the pandemic in 1918, the Spanish flu, which caused so much devastation at the time. The Spanish flu was finished about a year and a half or 2 years after it begun. So there was a period, and then we all know what happened after that Spanish flu. We ended up in the Roaring '20s. So I would be optimistic that we will see the Roaring '20s again repeated when this pandemic is well and truly dealt with in a year or so.
Here's hoping, looking forward to the Roaring '20s. Well, Northern Ireland's been in lockdown now since Boxing Day, obviously. Ministers are meeting next week to decide what the next step will be come the 5th of March. Do you think it would be a wise idea, Ultan, if we were to come out of lockdown then and possibly, reopen the hospitality sector and reopen non-essential shops?
No, not at this time. I think the numbers are far too high, and the fact that we are in the middle of winter, when most of interactions that people will have will be indoor, we run a major risk when we increase the permission of people or the encouragement of people to mix with one another. The virus will just absolutely love those conditions and will begin to transmit very rapidly again, and we'll end up with a similar type of situation as we had just before Christmas. So what I would like to see is that we be very careful, slow, follow the data until we get the numbers down to very, very low levels, like low single digit numbers on a daily basis at worst. And then coupled with that, accelerate as much as possible the rollout of the vaccine so that we protect as many people as we possibly can. I think the combination of those two events will allow us to get to a situation whereby we will be able to relax restrictions with more comfort and more certitude than we have had up to now.
Well, with that said, Ultan, in your opinion, in terms of us beating this virus, what is the best thing that ministers could do next week? Is it to keep restrictions, as they are, or what would you be suggesting?
The numbers we have at the moment, I don't think that's going to change in a week. So yes, I would be advocating for a maintenance of the current restrictions that we have. I'd like to see more data. We're kind of hovering around the 250, 300 mark for the last week or so in terms of the number of cases. I'd like to see more data of where those infections are happening and why, so that perhaps maybe there's more attention could be paid to those, where the actual infections are occurring in terms of further restrictions, specifically related to try and get those numbers down to a much, much lower level.
Well, we heard earlier this week, Ultan, that we should be, we could expect some restrictions right into 2022. What shape do you think those will take? Is it going to be the restrictions that we're facing right now, like the full-on lockdown, or what way will they be looking?
Again, that will be dictated, Jordan, by the actual data, the number of individuals that are infected, the number of people in the hospital, the capacity of the health system to be able to cope with the number of infections in the community. So those are the factors that will dictate what kind of restrictions will be put in place. I would very much hope, and I would be reasonably confident, that the way we're going is certainly in the right direction. As we come into spring and summer, there'll be a lot more outdoor activities and therefore less risk of transmission. It's not going to eliminate transmission, but less risk of transmission compared to what we would have in very cold weather during the winter. So I would suspect that we'll have ongoing use of masks, ongoing consciousness in relation to social distancing, etc. That all of the things that we're doing now, above and beyond the vaccines and the drugs that have been developed over the last year, I think all of those are likely to be in place with us for quite a while to come yet.
Well, finally, Ultan, we're almost a year now since the beginning of the pandemic, and you've been studying the virus for most of that time, I would say, probably as well. Has the pandemic developed over the past year as you would have expected it to last March, maybe?
Good question, Jordan. So expected, probably yes, in that the virus, obviously we were learning about the virus in real time. I mean, we're living the pandemic, and this is something that very, very few people in the world, even me as a virologist, has ever seen before. So expected. I teach about pandemics and pandemic preparedness to our medical students. So this is something I've discussed with them for many, many years, and it's uncanny to see the number of items that will be, or that have been put in place as a consequence of the pandemic. So really interesting from that point of view. I still think there's a lot we need to learn about the virus. There's still the capacity to mutate. How quickly does it mutate, and what are the factors that are causing it to mutate to these new variants? And is there any way we can mitigate against that? I think there's a huge amount of work we still need to be done there. On the positive side, I'm still blown away by the scientific effort that's been put into the pandemic. And, the idea that we have a vaccine or a number of vaccines available within 9 months of the virus sequence being published is phenomenal. I mean, that's really almost science fiction stuff, but it's not science fiction, it's reality. It actually happened. And similarly with the drugs that are being developed, in that very short period of time, we have a huge impact on the death rate associated with the virus because of the development of drugs like dexamethasone and more recently an IL-6 receptor antagonist that's capable of blocking the inflammatory response to the infection. So this is amazing. Science has delivered, and I'm really proud to say that a lot of my colleagues internationally have done an amazing job in coming together, exchanging data, exchanging information, and getting to a stage where we can actually have a huge impact on the trajectory of the pandemic. From a side effect of the pandemic is very intriguing as well, in that, as you know, we're concerned every single year with influenza, and the virus I work all the time with is called respiratory syncytial virus, or RSV. And these are part of the annual winter epidemics that we have that cause a tremendous amount of morbidity and a non-negligible amount of people who die from these infections every year. But this year, because of our mitigations and restrictions that we've put in place to deal with the SARS-CoV-2 pandemic, we're virtually seeing none of these viruses, neither influenza or RSV, circulating at the moment. And that was totally unexpected from my perspective, but it just shows, we're learning something new about how we can control, perhaps in the middle of a winter, like in the flu season or the RSV season, that we might be able to have a much bigger impact on these diseases without, or on top of the vaccines and drugs that are currently available.
Yeah, well, like you say there, Ultan, I mean, the scientific and medical, advancements that have been made this year are staggering. I mean, remarkable. But I know I said finally in that last question there, but just to finish on a bit of a brighter note, what's the best case scenario for this year, for 2021? What is the best case scenario for this year?
I'd say the reality more than the best case scenario. The reality, I think, is that if we are very careful with, we're learning more and more about the disease and how easily it is to introduce new variants into places like Northern Ireland, right? So I think slowly but surely we're coming to the idea that we can control the transmission if we diminish significantly the amount of interactions we have within the community. That's the first point. So these are all the mitigation circumstances that we have put in place and we've been living with for the year. And that includes, more stringent lockdown, less stringent lockdown, depending on the numbers in the community. We also know that the virus is transmitted from country to country by travel. So I'm hopeful and optimistic, and I think that's happening now, is that unrestricted travel during the pandemic will lead to problems. So there needs to be some control on travel within the UK, for example, from GB to Northern Ireland, and internationally. So in other words, treating Ireland as an island that we can control where people are coming from. If they're coming from zones that have new variants, we need to restrict that as much as we possibly can. And then the other part of it then is make sure that the vaccines are rolled out globally, because it's not good enough to control the infections here in Northern Ireland or the UK or Ireland. But if we ignore the rest of the world, we will always have the possibility of new strains, new variants coming into the countries and causing the devastation we have. So in terms of the best case scenario, I think things are going to get better. I have no doubt about that. The vaccines will make a big difference in terms of severe disease, the major difficulties associated with the health system and the health system being able to cope with the level of infection that's going on. So I have no doubt that will diminish significantly, providing we don't get another scary variant, as the case may be. Once the summer comes, a lot more activity outdoors. I think there'll be a lot more interaction with people on an outdoor basis. So I think from that point of view, when the numbers are really low, we should get back to some kind of interaction, sociability at that time. It might take longer, as I say, while we're waiting for the vaccine to be rolled out across the whole of the population, to have more normality compared to what we've had before. So again, I wouldn't count out the possibility that we will have some kind of restrictions for the foreseeable future. I would agree with the Chief Medical Officer in that case.
But at least there's some things there for us to look forward to. Ultan, thanks so much for coming on tonight and explaining that all to us in terms that we can understand. I always feel so much brighter after having had a conversation with you like a scientist myself. But thanks so much for coming on tonight. Really appreciate it. And thanks as well to everyone who got in touch with your questions. We didn't get back to all of you this week, but hopefully the questions that we have answered will have gone some way in explaining what's going on this week. Don't forget, you can keep up to date with all the latest developments on the BBC News NI website, which you'll find at bbc.co.uk/newsni. And we're on social media as well. We're on Facebook, Instagram, Twitter and YouTube. That's 4 of them. So if you just type in BBC News NI on there, you should find us. That's it from us this week. Next Thursday, the executive meet to review the restrictions in place in Northern Ireland. And we'll be back that evening with our political reporter, Jane McCormick, to discuss the latest and what changes, if any, that there may be. I'll see you then. Stay safe.